Hi everybody, I'm Allison Godlove. Welcome back to our Facebook Lives from AGD 2023. We are just outside the new Dentist Lounge. This area is exclusively for new dentists and students with education, and there are networking opportunities, and they're all catered specifically to their needs. Joining me now is Dr. Melissa Seibart, who is lecturing on the total picture on teeth whitening. Thank you for joining us.
Thank you. I'm excited to be here.
Yeah, it's great to see you. So tell me a little bit about what people are going to learn in your course today.
So I'm going to be teaching on the total picture of whitening, which involves bleaching, but it also involves restorative treatment, and helping dentists to see that there's a lot of really conservative options at their disposal to give patients the outcome that they're looking for.
And when somebody comes into this course today, and are they going to be able to take this away, and what are some of the things that you want them to take away from this course?
They are. With any educational presentation I'm giving, I'm always trying to focus on things that are actionable to them, things that they can take back into their office, things they can equip patients with. So I'm actually going to be showcasing several cases that you might be thinking you have to do veneers on, but actually you can accomplish this goal with just whitening.
Now, we're talking about new dentists, we're talking about students, so let's talk about you a little bit. What is one thing that you're glad you did out of dental school?
I invested in continuing education. You know, dental school is only 4 years, and there's so much dentists need to know. So I sought out solid mentors, study clubs, and I certainly invested in education.
Now, people at home are watching. They weren't able to come here to AGD 2023. Why would you encourage them to go to AGD 2024?
This is a great opportunity. It's an opportunity to see a whole array of different topics. So if you're interested in anything from aesthetic dentistry to implants, there's some really world-class speakers out here that you want to come see.
Thank you so much for your time. We're going to let you go get ready for your course.
Awesome. It's my pleasure.
I'm here now with Jasmine and Greg. Both are participating in this lecture today. Thank you for joining us.
Thanks for having me.
Yeah.
So why did you choose this lecture?
I want to go into general dentistry. I think at a school level we focus a lot on disease control, but once you get into general practice, you're going to be working more on the maintenance phase. You're going to be doing teeth whitening, and I want to get some more exposure to that and learn more about that.
And why did you choose it?
Pretty similar idea. We really don't get that much experience in dental school about teeth whitening. I kind of wanted to learn some of the science behind it too, and kind of understand what's going on with my patients before I actually do it in real life.
What are some of the things that you've been learning here at AGD?
A lot of stress relief techniques. We're all currently taking boards, and it's a pretty stressful time. On top of the dental school stresses. But not only that, like when we're actually in practice, I'm sure there's going to be tons of stress. So it's a lot of stress relief, a lot of new stuff we haven't learned, like the teeth whitening. I'm here to learn a little bit about implants too, because we really don't get that much experience in the school setting with the implants, kind of that kind of thing.
Yeah, I feel like I've been learning about new technology here. I know we don't have to deal with like software management and stuff yet, but like seeing all the booths and stuff like that is interesting. If I ever want to open my own practice, I have a lot of network connections and stuff I can reach out to.
So this is on Facebook Live. People are watching from home. They weren't able to make it here to AGD 2023. Why would you encourage people to come to AGD 2024?
All the networking connections, seeing all the new products, being able to test everything, meeting all the new people, all the classes, they're amazing. Yeah.
Not only just learning more things, it's good to take a break sometimes. And this week off is really nice, for us dental students too, because we can just kind of breathe in and breathe out. Mental health is really important for, even us providers, so we can adequately help our patients out.
It's nice to have something like that and to come here and have those conversations with people in the industry.
Exactly, that's great.
Yeah.
Well, thank you so much for your time. We appreciate it. We're going to let you guys go get ready for the lecture. Thank you.
All right, thank you.
Thank you so much. Again, we have a clue word for you as we wrap up.
Here's another case. This is a patient, mid-30s, single mom. She wants a whiter smile. She's also had previously completed endo. The previous restorative dentist was trying to get her to a whiter smile. They did internal bleaching the last year or two, but then she was discouraged because she wasn't able to get a whiter smile. So I want you to be thinking in your minds, how would you treat these cases? Because each and every one of these is going to be approached a bit differently. By the way, can you guys hear me? It's like there's so much ambient noise back there. My speakers are loud enough? Good deal. Really in the sound. So then, here's another case. This is a patient, large diastema. This was part of her tooth complaint. She hates the composite. She wants a wetter smile. She wants the diastema closed. And then this case, this is a gentleman that said, I want the simplest option possible. I want to walk out here as soon as possible with a brighter smile. I'm not going to do trays. I'm not interested in bleaching. What options do I have? And then finally, this is almost the opposite. This is a hot topic in restorative dentistry, treating white spot lesions. And so this is actually going to be the opposite. This is not going to be about, in this case, getting a bleach smile. This is going to be about making his teeth blend with the rest of his smooth tissue. And here we go finally. This is a patient, friend of mine. This patient had a vital tooth. She didn't have previously completed endo. She also wanted a whiter incisor. It really bothered her. She was really self-conscious about it, and her wedding was coming up. So she was wondering, what can you do for me in a day or two? So in my roadmap, I'm going to show you a lot of cases. I'm going to equip you so that you can walk out of here feeling very comfortable treating each and every one of these cases. I'm going to discuss the science behind bleaching, and I'm going to review some of these cases. So this is the first one. And so again, I want you to ask yourself, what's the most conservative and reasonable option? How many of you guys would restoratively treat this patient? Can you guys just give me a show of hands? Would you be thinking of porcelain veneers, composite veneers? None of you guys would do it restoratively? All right. And then I also want you to ask yourself, you know, on the current evidence-based literature, is at-home bleaching more effective than take-home bleaching? Because this certainly, the way that it's marketed to patients is that the most reasonable, the most effective, the fastest option is going to be a restorative treatment option, or an in-office option. And so, really, there is a very recent publication that came out, and they determined that in-office bleaching is as effective as at-home bleaching. So, I mean, this can be sort of a very reassuring option to patients where they're going to be able to achieve what they're looking for. It doesn't necessarily have to be under the care of a dentist in a dentist's office. So, let's start with the different modalities, because there's in-office bleaching, there's take-home bleaching under the supervision of the dentist, and then there's consumer direct over the counter. So, with in-office bleaching, this is oftentimes where we're seeing the higher concentrations. Concentrations of hydrogen peroxide, 25 to 40%. And this might require multiple visits. And so this is something where you want to be setting the expectation for your patient, where they might not be able to leave the office same day with the bleach smile that they were hoping for. And if there is anything that I've learned, I know there's some experiences here, I know there's some newer dentists here, but it's going to be all about setting your expectations. Because when patients come to the office, they're paying for bleaching, they're paying for a certain outcome. And it's really setting the expectation because they're going to bring in photos and they're going to think that by having bleaching, all of my incisal edges are going to be aligned, all the rotations are going to be worked out, the generalization is going to be where I want it to be. And it's never quite that simple. So starting with expectations. Oftentimes with in-office bleaching, not always, but oftentimes, it's going to be more expensive. And as well, you're going to see oftentimes lights are incorporated into it. So LED lights, pack lights, even a halogen light can be used. But the most recent evidence, we have a recent meta-analysis that shows that there's no significant difference achieved when you just use a bleaching agent versus a bleaching agent with a clean light. So keep that in mind. I know so many of your patients are asking me this. Should I be doing this in the office? Am I going to get a better outcome if there's a light involved? There's different theories as to why that might be. But in this meta-analysis, it shows no difference. So that's going to be a first important thing.
Again, we have a clue word for you as we wrap up this AGD 2023 Facebook Live. The clue word is save. So be sure to send that clue word, save, and your contact information to marketingdept@agd.org. Thanks so much for joining us for this Facebook Live. We'll see you back here in just a little bit.